Chapter 31, Sleep and Rest. In this chapter, we are actually going to see how important it is for patients who are sick to get rest and, most importantly, sleep. Disclosure: I do not own any of this material. This material is for educational purposes only. Sleep versus rest. Sleep is a cyclically occurring state of decreased motor activity and perception. Body functions slow, and metabolism falls by 20 to 30%, so the body conserves energy. Sleep is characterized by altered consciousness. So, for example, a sleeping person is unaware of the environment and responds selectively to external stimuli. For example, an alarm clock, bright light, or other meaningful stimuli usually awaken a sleeper, but everyday background noises and soft light do not. Rest is mild to no activity. Rest without sleep is inadequate. At rest, the body is disturbed by all exterior stimuli, whereas in sleep, it is screened from them by altered consciousness. Thus, sleep restores the body. Rest alone cannot do this. So once again, rest, you can sit down in a chair, you can relax, you're stress-free. It makes you, it leads to feeling refreshed. But once again, rest without proper sleep is inadequate for healing. The benefits of sleep. Sleep increases mental performance. It improves learning. It helps in storage of long-term memory. It also restores energy. It improves the ability to cope. And it strengthens the immune system. So a person who is actually at the hospital sick and they're not getting enough sleep, it's not going to be able to cope with what is happening with his sickness. They're going to be in a bad mood, versus a person who is actually able to sleep. They're better able to cope with their situation. It gives the individual a chance to mentally repeat and rehearse facts and situations before they are encountered in wakeful life. Some evidence suggests that sleep and dreaming may facilitate the storage of long-term memory, perhaps by assisting the brain in reorganizing and storing information. Older adults have an even greater need for sleep to protect against the natural cognitive function decline that comes with aging. Sleep also appears to reduce stress and anxiety. It improves our ability to cope and concentrate, as mentioned earlier. More sleep also reduces the body's sensitivity to pain. Sleep, rest, and illness are interrelated. Illness and injury increase the need to sleep, at the same time make it difficult to sleep. In turn, lack of sleep increases the susceptibility to illness by compromising the immune system. People who are ill or injured need more sleep than usual to restore the energy needed for tissue repair and healing. However, they often have difficulty resting because of pain and other symptoms of their illness. Terms to know. Circadian rhythm. It's going to be our internal clock. It's a 24-hour day-night sleep-wake pattern, and it affects overall level of functioning. So the circadian rhythm, as defined by the book, is a biorhythm based on the day-night pattern in a 24-hour cycle. The term comes from the Latin word circa, meaning about, and dies, meaning day, once a day. A person's circadian rhythm is regulated by a cluster of cells in the hypothalamus of the brainstem that responds to changing levels of light. That is why when you walk into a patient's room in the daytime, they have their windows closed, their room is dark, you should, as your plan of care for them so that their circadian rhythm is not thrown away, or as we just, in plain English say, you got your days and nights mixed around. Open up the lights, open up the windows so that they can get light. You want to encourage your patients to sleep at night, not during the day at the hospital. Circadian rhythm affects our overall level of functioning. For example, most people have a higher energy level in the daytime and less at night. However, some people are most alert and active in the morning, and others function at a higher level in the afternoon or evening. The reticular activating system, or RAS. Reticular and cortical neurons are called the reticular activating system, or RAS. Neurotransmitters associated with excitatory and inhibitory sleep mechanisms include catecholamines, serotonin, histamine, and prostaglandins. L-tryptophan and adenosine promote feelings of sleepiness. Okay, so for the stages of sleep, we have NREM and REM. So NREM, which stands for non-REM sleep, is also called slow wave sleep because it is characterized by the presence of delta waves. NREM is divided into 4 stages, each deeper than the one preceding it. The parasympathetic branch of the autonomic nervous system becomes progressively more dominant during each stage of the NREM sleep. During this phase, muscles relax, body temperature lowers, and heart rate, respirations, and blood pressure decreases. Rapid eye movement, REM, sleep is essential for mental and emotional restoration. Loss of REM sleep impairs memory and learning. So the best sleep occurs in when you are in REM, rapid eye movement. Your book goes into great detail in page 1286, table 31-2. It takes you through these stages. So with the wakefulness stage, you're pretty much alert, you're blinking with the eyes, and then you go into NREM. So the first stage, or stage 1 of NREM, the characteristics. You transition between wakefulness and sleep. Slow eye movements. Light sleep, can be awakened easily. Okay. In stage 2 of NREM, characteristics are light sleep, easily aroused, accounts for about 50% of the total sleep. Temperature, heart rate, and blood pressure decrease slightly. In stage 3 of the NREM, you are deep sleeping. You're difficult to arouse. If awakened in this stage, you might be confused, okay? And then for your last stage, which is the REM, which is once again where you get emotional and mental restoration. This is where eyes move rapidly and small muscles twitch. And it is essential for mental and emotional restoration. Okay, clicker check. Light sleep and slowing brain and body processes are associated with which stage of NREM sleep? The answer is going to be NREM 2, which is B. And these are characteristics of a person in stage number 2 of NREM sleep. Some factors affecting sleep. Age. Sleep patterns are affected by age. So for example, newborns and young children experience prolonged REM. They need more sleep time than adults, 15 to 18 hours for babies. Young adults spend about 25% of their sleep in REM, and older adults typically enter REM sleep quicker and spend more time in this active phase of sleep. Lifestyle factors, physical activity. If you don't have enough physical activity, you're not going to fall asleep as fast as a person who's been physically active throughout the day. This is something that you can actually recommend to your patients who are not falling asleep when they go home, or they have trouble sleeping at home. Is you can actually recommend that they go for walks or they exercise, and try this out to see if it actually helps. Foods such as alcohol, chocolates will mess up with your sleep. I know that chocolate, for example, contains caffeine, and you eating chocolate right before going to bed, or alcohol consumption, can make a person stay awake. We have medications such as Ambien, right? Many of the medications people take cause either sleeplessness or excessive grogginess and sedation. Medications to induce sleep, hypnotics, tend to increase the amount of sleep while decreasing the quality. Ambien promotes normal REM sleep and appears to influence sleep quality less than other hypnotics. Amphetamines such as Adderall, right? If you're taking that, you're not going to be able to fall asleep. So medications can either help you fall asleep or cause the other. Not for you, for example, not being able to fall asleep. Beta blockers, for example, they have been reported to cause insomnia and nightmares. Food, let's see here, caffeine, right? Caffeine and nicotine. Central nervous system stimulants such as nicotine and caffeine interfere with sleep. Smokers tend to have more difficult falling asleep and are more easily roused than non-smokers. People who stop smoking often experience temporary sleep disturbances during the withdrawal period. Caffeine blocks adenosine and thereby inhibits sleep, prevents sleep. However, individuals vary greatly in their sensitivity to caffeine. Illness increases the need for sleep and rest. At the same time, it is associated mental and physical distress can cause sleep problems. Fear of a person, for example, not knowing their outcomes of the illness, and obviously the role changes associated with hospitalization can cause anxiety. Disease symptoms such as fever, pain, nausea, and respiratory conditions can also interfere with sleep. Specific disease conditions altering the quality of sleep are allergies, hyperthyroidism, and Parkinson's disease. Environmental factors such as the temperature and humidity. I know that, for example, when it's hot, it's hard for me to sleep. The noise and the light, I like my room to actually be dark, and if there's noises around, I'm not able to fall asleep. That's why I use earplugs when I actually go to bed, because I don't want to be awakened. Odors, right? And then comfort of bedding. I know patients that have come to the hospital and they tell me, hey, I'm not able to sleep just because this bed is so hard. So obviously the comfort of the bedding can affect the way a patient sleeps. Common sleep disorders. Insomnia is going to be the inability to fall or remain asleep or go back to sleep. Also, I want to clarify that in order for someone to be diagnosed with insomnia, they have to have difficult sleeping at least 3 nights per week for the last 3 months. Circadian disorders. These are going to be abnormalities in sleep-wake schedules that might be caused by rapid time zone changes, such as jet lag, shift work, or a change in total sleep time from day to day. Symptoms include decreased vigilance, decreased ability to perform psychomotor tasks, and short sleep episodes, microsleeps, that the person is not aware of. People suffering jet lag need several days to adjust their sleep-wake schedule. So the symptoms, once again, I want to pay attention. I want you to pay attention to them. So symptoms include decreased vigilance, decreased ability to perform psychomotor tests. So a person who, is not used to working the night shift, for example, nurses, right? Let's say that you get a job at night and you're not used to working at night. Just be careful of not making medication errors, right? Because you are going to be in decreased vigilance state. Restless legs syndrome is a disorder of the central nervous system characterized by an uncontrollable movement of the legs while resting or before sleep onset. It tends to run in families. It affects 5% to 15% of Americans. Children and young adults experience this condition, but it is especially common in older adults, and it is sometimes associated with low levels of iron and use of some antidepressants. Some of the things that you can recommend to your clients or patients who actually have restless leg syndrome is that before going to bed, they can either stretch and also get a massage. It will help them with a restless leg syndrome. You have also hypersomnia. This is excessive sleeping, especially during the daytime, sleep-related or disease-related, and can be related to depression. Sleep apnea. This is going to be a periodic breathing cessation for at least 10 seconds during sleep. An absence of airflow through the nose or mouth during sleep, typically the soft tissue of the pharynx and soft palate collapse and obstruct the airway. Episodes may occur several or 100 times a night and may last for as long as 1 minute or longer. During periods of apnea, the oxygen level in the blood drops and the carbon dioxide levels rises, causing the person to wake. This may result in cardiac dysrhythmias and increase in pulse and blood pressure. Narcolepsy is a chronic disorder caused by the brain's inability to regulate sleep-wake cycles normally. The distinction between being asleep and being awake is blurred. At various times, the person with narcolepsy experiences a sudden, uncontrollable urge to sleep, lasting from seconds to minutes, even though the person sleeps well at night. The person cannot avoid the sleep episodes but awakens easily. Narcolepsy is characterized by sleepiness, slurred speech, slacking of the facial muscles, and feeling impeded weakness of the knees, paralysis, and hallucinations. One of the things that you have to worry about a person with narcolepsy is safety. So with these people, a lot of the times when they've been diagnosed with narcolepsy, first of all, they have to get treated for it. Okay, they're put on medications. But one of the things is you have to be worried about their safety. So education comes as to not driving or not operating, machinery or doing something where they're going to fall asleep and cause harm to themselves or to other people. Safe, effective nursing care. The basis for safe, effective nursing care is thinking, doing, and caring. You are caring for an older adult who has restless legs syndrome. What is restless leg syndrome? What might you do to relieve symptoms? How might you show care and compassion for the patient? Think about these. So for the thinking portion, we know that restless leg syndrome is a disorder of the central nervous system characterized by an uncontrollable movement of the legs while resting or before sleep onset. The unpleasant creeping, crawling, itching, tingling, or burning sensations in the legs is relieved only by stretching or moving or massaging. The feeling tends to be worse in the evening and at night. This condition tends to run in families and occurs more often in older adults and women. Restless leg syndrome can make it hard to fall asleep and stay asleep. It may make the person feel tired and sleeping during the day, which interferes with learning, work, and other daily activities. Not getting enough sleep can also lead to depression, mood swings, or many other physical and emotional health issues. Alright, so for the doing. If restless leg syndrome is severe, treatment may include neuroleptic agents and medications used to treat Parkinson's disease. People with severe symptoms might require anticonvulsant medications to control the creeping and crawling sensations in the legs. As restless leg syndrome interferes with falling asleep, you will need to assess for insomnia or other indicators that suggest your patient should undergo a thorough sleep history. You might recommend that your patient consult a specialist in sleep or movement disorders. For the caring part, be aware that restless leg syndrome is a condition that affects quality of life. You can show compassion by empathizing with the unpleasantness of the symptoms and alterations in sleep that it can cause. Some patients report that complementary and alternative therapies relieve symptoms. These therapies include massage, acupressure, medication, music therapy, cold or hot compresses, vibration. Also suggest the patient regularly tries walking, massaging, and stretching. Encourage the patient to make lifestyle changes that may minimize symptoms. Mild restless leg symptoms may respond to such measures as eliminating caffeine, tobacco, and alcohol, getting moderate exercise, establishing regular sleep patterns, and maintaining behaviors that promote health. Behavioral modifications include coping strategies and attending support groups to learn how to manage restless leg syndrome. Clicker check. The nurse is caring for a hospitalized client who normally works the night shift at their job. The client states, "I don't know what is wrong with me. I have been napping all day and can't seem to think clearly." The nurse's best response is A. You're sleep deprived, but that will resolve in a few days. B. You're experiencing hypersomnia, so it will be important for you to walk in the hall more often. C. There has been a disruption in your circadian rhythm. What can I do to help you sleep better at night? D. I will notify the doctor and ask him to prescribe hypnotic medications to help you sleep. And the answer is going to be C. The data suggests that the patient is used to being awake at night and sleeping during the day. The hospital routine has disrupted his normal pattern. Which sleep disorder would the nurse most likely need to include safety measures in the client's plan of care? A. Snoring. B. Enuresis. C. Narcolepsy. D. Hypersomnia. And the answer is going to be C. Narcolepsy. Narcolepsy can occur suddenly during the daytime hours when the person is involved in any type of activity. This could put the person at risk for harm depending on the activity in which they are engaged. Assessment. It is important to assess usual sleep patterns and rituals for all patients who are being admitted to the hospital or seeking help for a sleep problem. A brief assessment for all patients should include questions about usual sleeping pattern, sleeping environment, bedtime routines, rituals, sleep aids, sleep changes, or problems. Analysis, nursing, diagnosis. It is important to determine whether lack of sleep is a problem, a symptom of a problem, or is contributing to a different problem. For health promotion applications, use the NANDA-1 diagnosis, readiness for enhanced sleep when a client has no particular sleep problem, but wants to move to a higher level of functioning in the area of sleep. When you wish to focus on interventions to promote sleep, use the following NANDA-1 labels on the problem side of the nursing diagnosis. Insomnia is going to be used for patients who have a disruption in the amount of quality of sleep to the extent that it impairs functioning. Sleep deprivation, used as the nursing diagnosis when the patient's amount, consistency, or quality of sleep is decreased over prolonged periods of time. Defining characteristics of sleep deprivation are more severe than those for disturbed sleep pattern. So nursing activities may focus as much on relieving symptoms, such as confusion, paranoia, as on sleep promotion. Disturbed sleep pattern. Used as a diagnosis when assessment data points to a time-limited sleep problem due to external factors, such as inability to sleep in the unfamiliar hospital environment. All right, so promoting sleep, some of the nursing interventions. You can cluster scheduled nursing care to avoid interruptions. So when you're going in to give the medications to a patient, offer maybe if they need a partial bed bath before going to bed, or see if you can help them with mouth care. That way you're clustering care and not going into the room often at night. Create a comfortable, restful environment. So you want to create an environment that is soothing, relaxing. You want to minimize the noise. There's hospitals now that have implemented a quiet time after 10 p.m. So literally they come in the intercom and say, now it is sleep time. Everybody please put their cell phones on silent. If you're watching TV, ask for some headphones. And this actually creates a restful environment for people who do want to sleep. You want to promote comfort and relaxation. Like I said earlier, you might want to offer them a partial bed bath. You want to offer them oral care. And then support their bedtime rituals or routines. If they need somebody to pray with them, or if they have some other type of rituals that they need to do in order for them to go to bed, provide it. Other interventions, you want to maintain safety of the client, put bed alarms on for clients who you think are going to, might wake up in the middle of the night, become confused, and get up and fall, right? Offer foods that help promote sleep. Obviously, don't offer coffee or chocolates. You want to teach about sleep hygiene. Administer complete client teaching about sleep-inducing medications as well. Socratic reasoning. You are the nurse caring for a patient in the ICU who is awakened hourly for neural checks and vital signs. With the round-the-clock interruptions in rest and sleep, what problems might you expect your patient to develop? And we will actually discuss this in class. Alright, this is going to be it for this PowerPoint on Chapter 31, Rest and Sleep.